Hi guys, we're fourth semester nursing students. I'm Alicia,
I'm Alexa.
and we're going to be doing a presentation for you guys today on sexual assault.
So according to the Wisconsin Department of Health Services, sexual assault is described as verbal and or physical act that breaks a person's trust and safety and is sexual in nature. Behaviors range from sexual harassment to unwanted fondling to forced penetration. All of these are done without consent. The legal age of consent in Wisconsin is 18. Sexual assault is one of the most underreported violent crimes. Sexual assault takes many forms, such as verbal sexual harassment, unwanted touching of intimate body parts, causing or forcing someone to view pornography against his or her will, sexual activity with a person who cannot consent, date rape, or sexual abuse of a child. No one has the right to force or pressure another person to participate in sexual activity. Everyone has the right to say no, even to a spouse or a dating partner.
Yes, and I think it's super important to mention, and we'll talk about this a little bit later, but that sexual assault can happen to anyone. So male, female, older people, younger people. It can happen within families or complete strangers. And I think the most important thing is that it's done without consent. So we have a video here that's going to play for you guys.
I was sexually abused when I was about 8 by an older male cousin.
I've been sexually assaulted on 4 different occasions.
I was 6 years old, the first time that I was molested. A neighbor named Hank took me into his house. And at first it was hugging, and then his hands traveled. And when I tried to push him away, he beat me. And then he raped me.
And I was haunted by the fact that this happened in a little girl's bedroom. For a long time, I blamed myself. I was just angry because I'd go to school and nobody in school knew what was going on.
When I tried to tell my mom, she kicked me out of the house and laughed at me and told me I would never deserve anything better.
It became something that lasted until I was 17 years old.
I remember after it happened and after he left, sitting on a bed for a while, torn up and saying, I am never going to tell another living person about this. I went and got my friends and I drove them home.
Thank you for reading that, Katrina.
Thanks.
Now, if you had the chance, how would you respond to this person's story?
I just feel like, or just like hug her. And just let her know it's not her fault.
You were a little girl. It's not your fault, honey.
You actually have the chance to meet that person because they're here today. This is James Metters. This is Mark Godoy Jr. This is Isaac Andrade. This is Walter Castaneda. This is Glenn Hall. He served in the Army for 30 years, retiring as Command Sergeant Major. And what you just read is his story. What you just read was his story.
Oh my God.
How are you doing?
Good. How are you?
Doing good.
Thank you for reading this story.
I know the statistic is 1 in 6. I'll go into a room and I'll count 6 men. Like there's somebody else in here and they're probably dealing with it the same way I've dealt with it, which is not talking about it.
To share the same experience, I was young and I was in college. I was sexually abused. We don't talk about these things, but it happens,
I grew up in a Latino household where
I know what that's like.
my dad telling me, no llores, cabrón. No eres vieja, you're not a girl, don't cry. And on the other side, you're getting abused and you don't know what to say.
I joined the Army to die. I was abused from the time I was born till I was 17. masculinity made me put away what I was feeling and not really deeply feel what had happened to me and recognize and acknowledge what happened to me.
Getting suspended in the 4th grade, getting in a fight, getting expelled from one high school. It's all part of the abuse, and it's all part of me and the child, my inner child, acting out and starving for attention.
One of the reasons I rose in the rank of the military, they like tough guys, but inside I was dying.
It still makes me emotional. That what happened to me wasn't because of who I am. It was something that was done to me. It's not me.
I know a lot of males are too afraid to speak up, but I'm real open because I want to inspire the male survivors. That's not just males with disabilities, but also males without disabilities.
I identify myself as a Black gay survivor. I had a lot of fear, and I just posted a link on Facebook saying, "This is my story. If you want to read it, you can read it." And the response I got after that was nothing but kind.
Every time I share my story, especially as a man, I always hear back, "Hey, can I talk to you? Yeah, what's up? This happened to me too. This happened to me too. This happened to me too."
I'm not doing it just for myself. It's for many others whose voices not been heard before.
It's really hard not to cry. I'm really glad you've done the work, and I know that you changed somebody's life. So that's all I can say without crying.
You can survive it. You can get through it.
I think you're just so strong. Like, I don't know if you know it, but you're very strong.
Thank you.
It just makes you remember and realize that everybody has a story.
So we're just going to talk a little bit about who are the victims and who are the perpetrators. So victims can be women, men, children, orphans, and some non-attributing factors, which means this does not play a role in the person being assaulted or abused. Those are race, ethnicity, gender, age, culture, religion, and socioeconomic status. Sexual abuse can happen to anyone. And some of the perpetrators could be family members, family friends, spouses, so a husband or a wife, a boyfriend or girlfriend, neighbors or people in the community, as well as strangers.
According to Women and Children's Health Horizons of Wisconsin, 88.9% of all sexual assaults were perpetrated by someone known to the victim, while 6.4% were committed by strangers. The average age of a Wisconsin sexual assault victim is 15.
So there's a national protocol for sexual assault medical examinations for adult and adolescents. So if these people decide to go to the hospital or the emergency room to be treated for what happened to them or any injuries that occurred, these are some of the guidelines that we want to follow. So we should offer guidance and use best practice recommendations specific to patient-centered procedures related to the examination process. And this protocol highlights providing patient-centered care because each patient will be different, so you'll want to provide care specifically for that patient, ensuring patient privacy, providing culturally responsive care, maybe using an interpreter if that's what's needed, accommodating support people as needed, using age-appropriate language. So if you're dealing with a 3-year-old versus a 20-year-old, you're going to speak and talk to them differently, addressing and respecting patient priorities, and integrating medical and evidence collection procedures.
So the Emergency Nurses Association position statement on care of sexual assault and rape victims recommends an individualized, multidisciplinary, and multi-agency approach, a physical and social environment conducive to private, empathetic, and unbiased care by healthcare providers, family members, law enforcement officers, and members of the justice system, a private and safe environment, a safe environment with personal limited to healthcare provider during sexual assault care. Interpreters must be available if needed with the consent of the patient. A specially trained advocate may also be present. Comprehensive, competent, and sensitive emergency health care. Employment of sane nurses in the emergency department is highly recommended. Emergency nurses should collaborate to promote establishing ongoing community education, and emergency nurses should be involved in research concerning the identification, assessment, and treatment of victims of a sexual assault and rape.
So for those of you that don't know, SANE stands for Sexual Assault Nurse Examiner. And these nurses usually work in the emergency departments of hospitals, and they usually have an on-call position, so they're available 24/7. If a sexual assault, a domestic violence, or a crisis happens, they'll be called in to care for these patients. They have special training to deal with these types of scenarios and patients. And it's really important that hospitals hire them because we want to provide the best care possible for these patients. Also, I know Aurora has a program that you can go to be certified as a SANE nurse, and also they hire SANE nurses in their emergency department as well. So before this video plays, the assessment of an individual when they come into the hospital for like a sexual assault can be really traumatizing and hard for that patient. So this is just a video that kind of puts into perspective what that patient might go through and what we as the healthcare providers can do to make them feel more comfortable and not re-victimize the patient because they have just had a really traumatizing experience.
Are you ready? You have to say it. It's the law. You say yes, we go to the next step. You say no at any time, we stop. Yes. Are you ready? Yes. In my head, up above so long as I don't sleep. Are you ready? Yes. Save me. It doesn't matter. Are you ready? What the craving here, there, everywhere goes high. Are you ready? Yes. 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 Don't leave me. Abby, we're done. Come here. Okay. I'm ready. Save me.
So for the assessment of that, you just want a generalized assessment. You want to know their level of anxiety. You don't want to start an assessment and be all over the place and in that patient until you understand where they're at. We want to assess their coping mechanisms. Are they able to deal with this? Are they not?
Maybe even coping mechanisms that they've used in the past to deal with other situations.
Right. And knowing, like, is this their first time that this has happened? Is this a repetitive kind of thing? And now they're finally getting this treatment. We want to know their support systems, who's at home, if anybody knows about it, or like I said, this is their first time even speaking up, coming in, seeking treatment for it. Signs and symptoms of emotional trauma. Avoid asking why. Don't ask why.
Why did you walk home by yourself?
Right. Because then it makes the person feel like it's their fault. You want to do signs and symptoms of physical trauma. So inspecting and palpating for injury, injuries to the face, head, neck, extremities, genital area, just kind of like that video showed, it's everywhere. And then we want to reduce the re-victimization. So explaining procedures in a way that's reassuring and supportive, making sure you get that verbal consent. Yes, they are willing to go, to the next step of the process, or no, they feel uncomfortable, and see where they're at.
So these are some other best practice guidelines when someone will come into the emergency room for a sexual assault or abuse. It involves 5 steps. So you will get a head to toe physical assessment, a detailed genital examination observing for signs and symptoms of injury or trauma, evidence collected and preservation. So that can also be from the genital area, under the fingernails, the mouth, on the skin. And then documentation of physical findings. So both written and photo documentation as well. And then they'll pretty much will focus on treatment, discharge planning, and follow-up care. Our little picture over here, this is something that I found on a website about SANE nurses. So we're going to provide compassionate care, gather evidence, and you may even be called to testify in court.
So just some nursing diagnoses that we found for these patients is they could have disturbed personal identity, situational low self-esteem from what's happened, interrupted family processes, as it could be the perpetrator could be somebody in their family, sexual identity, sexual dysfunction, anxiety of going forward through different situations, social situations, maybe with that patient or person, fear of the perpetrator, fear of surroundings, maybe where it occurred, and social isolation. They don't really want to go back and have that same experience happen to them.
So planning, if the patient has sustained serious physical or psychological injury, they will be admitted and treated for those injuries. But in the emergency department, the plan of care focuses on treatment options, follow-up care, and information about community resources or help that is available to them. So treatment options can include testing for sexually transmitted infections and prophylactic medication to treat those infections that they may have gotten. Follow-up care includes additional testing for sexually transmitted infections that maybe didn't show up the first time they were there with you, emotional and/or physical support for the injuries or trauma that was sustained during the assault, pregnancy testing and pregnancy prevention, some community resources specific to the Wisconsin and Kenosha area, Planned Parenthood for women's health for the uninsured. I know that they have a program for women of childbearing age where if you're uninsured, based on your income, you can get birth control, annual examinations, testing for STDs, as well as many other things that they can help you with. Planned Parenthood also is not only for females, men can also go there and get tested for sexually transmitted infections and get more information about their health and things like that. And then Women and Children's Horizons has a sexual assault program. And we'll talk about a little bit about that on the next slide. But first, it's really important to identify any factors that may cause difficulty with follow-up and ongoing care. So you want to make sure, does your patient, do they have a car? Are they able to get to the follow-up appointment? Are they in the right mindset or headspace to be able to call and make appointments or fill out paperwork? And do they just have the will to continue care? So those are things you want to assess before you just hand them a bunch of papers and send them on their way. You really want to make sure that they're able to make those next steps to better themselves and and start their healing process.
So Women and Children's Horizons, they advocate for victims of domestic and sexual violence. They are legal, that you can do legal advocacy, and they can help with restraining orders. They do referrals to community resources, so anything that like for Women and Children's Horizons in Kenosha, they can help with other outlets here. They have sexual assault support groups. They have 24-hour emergency shelter for women and children. I know men can also go there too, so it's not just limited to women and children. And then they have one-on-one advocacy services. And on the side, we just have those helplines, because there is the one for Kenosha, the 262 area code, but then there's that toll-free line that's 24 hours.
So people can have long-term repercussions of sexual assault. So patients will have varying emotional responses. However, most survivors of sexual assault will experience symptoms that meet the criteria for the diagnosis of acute stress disorder or post-traumatic stress disorder. So acute stress disorder usually begins immediately after whatever the situation was and persists for at least 3 days and can extend for up to 1 month. Now, if it's lasting longer than 1 month, they may be diagnosed with post-traumatic stress disorder. Patients can have intrusive symptoms, so dreams or flashbacks about the incident. They can have negative thoughts, moods, or feelings. So maybe just staying inside all day, just replaying that situation in their head. Dissociative symptoms, so they may try to dissociate themselves from what happened. Avoidance and arousal symptoms, so troubles with falling asleep, waking up, things like that. And then, like I said, if these symptoms last longer than 1 month, the diagnosis may change to PTSD. And with PTSD, the symptoms are similar. In children less than 6 years of age, school-age children, adolescents, and adults may be diagnosed with this disorder.
So we have a couple questions. These are just NCLEX style questions. Ron is a victim of sexual assault and has revealed to his family and friends the fact that he was raped. The family reacts with horror and disgust, and the nurse caring for Ron recognizes A, Ron's family is being judgmental, B, Ron's family should leave the hospital, C, Ron's family will also need support, or D, the family has dysfunctional family dynamics.
So the answer is C, Ron's family will also need support. So just like in other areas of nursing where we treat the family members as well as the patient, in these situations, we also need to remember that the family, this may come to a shock as the family. They may not know how to handle information as this, because it really can be troubling, especially if it is someone within the family that caused this. So you also need to offer support to them as well. You are working at a telephone hotline center when Abby, a rape victim, calls. Abby states she is afraid to go to the hospital. What is the nurse's best response? A, I'm here to listen and we can talk about your feelings. B, you don't need to go to the hospital if you don't want to. C, if you don't go to the hospital, we can't collect evidence to help convict your rapist. D, why are you afraid to seek medical attention?
So the answer is A, the nurse should encourage the patient to talk about her feelings and actively listen to the patient when she is talking about them. The nurse should always avoid using why questions, because it makes the patient feel like they're at fault. And the nurse should avoid bringing up conviction against the rapist. It is up to the victim and how they want to proceed. And then the last question, a college student was sexually assaulted when out on a date. After several weeks of crisis intervention therapy, which client statement would indicate to a nurse that the student is handling the situation in a healthy manner? A, I know it was not my fault. B, my boyfriend has trouble controlling his sexual urges. C, if I don't put myself in a dating situation, I won't be at risk. Or D, next time I will think twice about wearing a sexy dress.
So the answer is A, I know that it was not my fault. B, C, and D are all answers that kind of places the blame on the victim. So saying, you know, the boyfriend can't control his urges, or if I don't put myself in that situation, or about what she was wearing. So if she makes a statement saying, I know that it was not my fault, that shows that she is handling the situation in a healthy manner, and she is moving forward to the next steps of healing.
So incorporating all of this into nursing practice, so moving forward, you always want to do a self-assessment of yourself. So understand your personal beliefs, the judgments you may have, the feelings you may have before going into each patient's room that you might be like dealing with this. And overall, you should always have your personal beliefs set aside because it's all about the patient. And remember to be compassionate, empathetic, and always provide patient-centered care because each victim's going to react differently. You're never going to have the same patient react the same.
Yeah, so you'll really need to individualize your patient care based on how that patient is presenting to you, and have that patient-centered care based on that specific patient that you are dealing with at that moment. So these are just some resources and references of where we got our information. We hope you guys enjoyed and we hope you guys learned.
I hope you incorporate it into your practice to just always keep your personal beliefs aside and be compassionate, empathetic, and advocate for your patient.
Yes. Thank you.
Thank you.